This month on the Taboo Topics podcast.
And red is that red warning sign. Now, a lot of patients get scared because, what is he going to do to me when I tell him it's red? Like, are they going to do all these crazy procedures? My friend came and told me that they put a big camera inside their penis or their urethra and it hurt a lot. Well, the reality is that is one of the things, but it's really not that bad. And I can say that because I've had that procedure done on myself when I had kidney stone surgery.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast@orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
Hello, welcome to our first episode of Taboo Topics, where we address embarrassing personal health questions and try to take some of the stigma out of those questions. I'm your host, Mary Frances Emmons, and today we're talking about what the color of your pee, which can have some surprising hues, can tell you about your health, including if and when you need to talk to a doctor. My guest for this episode is Dr. Jamin Brombach. He's a urologist and a sexual health expert at Orlando Health.
Hey, thank you so much for having me on this podcast, Taboo Topics. I hear taboo topics all day from patients that come and see me in the office. So it's pretty cool to be able to have these conversations with a broader audience and hopefully get the man that's sitting on the couch out there or the lady that's just doesn't want to wait for the person to pick up the phone to make the appointment. Hopefully we get you inspired to go and get yourself checked out.
So we're just going to kind of jump right in. Dr. Brombach, what does the color of your pee tell you and what kinds of things can affect that? Food, medicine?
So first, you got to know what the normal color of urine is. So a lot of people assume it should be yellow. Some of my patients think it should be orange. The reality is your urine should be clear. So if you're looking at it kind of like through a water bottle, let's say a water bottle, it's always clear. And if it's a little yellow tinged, sometimes even amber if it's in the morning, that's okay. So any light shade of yellow that is clear and transparent that you can see through is likely probably a good color of your urine.
I read that the normal color of urine is described as urochrome, which I thought is actually the color of a hot new nail polish. Not really, but it could be.
Yeah, I've actually never heard that.
You never heard that?
I'll have to go on ChatGPT and ask ChatGPT to help me explain that. But I don't think any of my patients know that. They just say, hey, doc, the color of my urine's yellow to some degree.
So what are the things that can change that effect? Like I know, I take an amazing super vitamin, and after you take that vitamin, oh yes, there is a neon color. Also, how much, if you drink a quart of water, it's really clear. And that this can change even over the course of a day or a few hours. So, does that matter? You said in the morning, it can be a little bit more amber. So a little bit of variation is not a cause for concern.
Well, first and foremost, there's so many things, as you said, can change the color of your urine. So I'll tell you a personal story. I got my labs checked. I had a B12 deficiency, started taking B12 supplements. And then I went to go pee and I'm like, holy crap, what's going on here? I forgot that I started taking these supplements. So I started looking at my urine. I started freaking out. And of course, as a urology mind, I'm like, okay, do I have this? Do I have that? Do I have that? So you're absolutely right. It could be the things that you're ingesting and not even know it. So you mentioned supplements. Yes, B12 supplements can change the color of urine. Other supplements can as well. Also, some of the foods like blueberries and beet can change the color of your urine. So yes, your diet really can change and affect it. But the things that we worry about as a urologist and as your primary care providers and any healthcare professional is really one color. Yes, there's other colors, but it's the color red. And yes, there could be other things that can cause it, but red is like that big warning sign that should kind of take you to the next steps and, talking about this with a healthcare provider, whether it's your primary care doctor or coming to see us as your urologist.
So I had a question about that because I read about something called, correct me if I have this wrong, sports-related hematuria, which that's blood in the urine, right? That's not considered a problem. It's associated with distance runners in particular. And I wondered, is that anything that you ever run into with people who, maybe are very active, but not a distance runner? Is that something that a very active person might encounter and not know, is this a problem or not?
Absolutely. Like that is one of the causes of blood in the urine. So when we look at blood in the urine, we look at benign causes, so things that nothing to worry about. And then we look at the more malignant causes. Those are things that you should be worried about. So yes, you absolutely mentioned runners, hematuria. When patients come in and see me and they're runners and they have hematuria or blood in the urine, I'm not just going to say, oh, it's because you're running. We're still going to do the full workup because we still have to rule out other causes. I've had so many runners say, oh, it's just because I run. And I read this on Google or heard about it on some channel that, oh, it's just because I run. I found cancers and tumors and kidney stones and enlarged prostates in all these patients. So you just can't assume it's that, that zebra or that outlier in the whole diagnosis spectrum. But beyond that, other causes of blood in the urine could be that, as I mentioned, you may have a kidney stone that's trying to pass. You may have an enlarged prostate that when the urine is trying to flow out of your bladder, it's just kind of shredding some of the lining of your prostate and causing you to have blood because of that. It could also be urinary tract infections. It could be sexually transmitted diseases. You could have some scarring on the inside of your urine channel, or patients that have had recent trauma, like they fell and their kidney got bruised. They can have blood in the urine because of those causes. So there's so many different reasons, but because this is a taboo topic, don't get bogged down on all these different details. All you have to do is pick up the phone and make an appointment and get yourself checked out.
More on this after the break.
This episode is brought to you by Orlando Health, the official health and wellness partner of Brightline Orlando. Orlando Health. Choose well.
And we're back. So to go back to the clarity of it, this is pretty much the hottest summer on record in the entire world. And, everyone is drinking just gallons and gallons of water, who has access to a good water supply. Is there such a thing as urine that's too clear? Is there such a thing as drinking too much water?
Well, I would say, at least in the patients I see and the people I know here in Florida, we're not drinking enough water. It's less about how much you're taking in, it's how much you're putting out. If you look at the general guidelines, recommendations, you should be putting out about 2 liters of water a day. So that could mean that you have to take in 2 liters of water, or that could mean you have to take in more. So on a hot summer day, you get dehydrated, you're perspiring. Then your amount of water that you have to take in should be more so you can balance things out. That seems to be the ideal number. But before everyone starts going and getting, a huge water system and starting to drink water and buying gallons of water, you can have too much water as well. So you mentioned that, hey, can you have too much? Absolutely. Like if you're taking in too much, in certain scenarios, you can kind of imbalance the salt in your body. When you sometimes watch these marathon runners going around, it may be because of dehydration, but sometimes they're overhydrated and the salt imbalance causes issues. Also, if you have heart issues or kidney issues because of some other cause, you have to be careful about drinking too much water because then you may overload your system. And when you overload your system, your body's not able to filter it out. And then that's when people get swelling and other issues. It's not hard and fast for everyone listening. 100% of you out there should not go ahead and start chugging down on water. There is kind of a fine art to it. And you have to take the entire medical picture into account.
So is there a way for a person to know what's too much for them? Or just if you have any of the symptoms that you've just discussed, pick up the phone?
Well, if you're reasonably healthy, have no other medical issues, and you're going to get your yearly medical checkups with your healthcare provider, whether it's a nurse practitioner, PA, MD, DO, and you have a clean bill of health, then your body should be able to tolerate whatever amount of water you take in. But this is what happens to my patients. I'm going to go off on a tangent here. I tell them to drink water, and this is what they do. They take a whole gallon of water, or they take a couple water bottles, and they drink it all at once. And then they're like, oh, doc, I'm going too much. And, I can't make it through a movie now because I'm peeing all the time. You're supposed to balance out the amount of water that we recommend over the day. So if you wake up at 6 a.m. and go to sleep at 10 p.m., then you should kind of balance it out every couple hours and let your body naturally hydrate out. If you just chug it all at once, your body's going to filter it all at once and you may not get the benefits of staying hydrated.
So what about not just color, but things like clarity? Like if your urine becomes cloudy or even foamy. I think gentlemen have that a little bit more because the stream is hitting the bowl water with a little bit more force. But, I think it's a thing. There is such a thing. So is that a time when you might need to talk to somebody?
Well, here's the thing is, how do I say this without saying it, without using the words I may use in the office? Men may have some changes in the texturity, or sometimes they may see some white pieces of tissue in their urine. It is a surprise in some patients because it's like, okay, how did this happen? But a lot of men that may not empty their pipes or ejaculate you're still making that ejaculatory fluid, which comes from your seminal vesicles, your prostate, some of the sperm from your testicles, and it all gets piled up and stored up until you ejaculate. But if you're not doing that, whether you have erection issues or you've taken a vow of celibacy, or you're kind of in between relationships or waiting till you're 30 and married, or you're 40-year-old virgin, who knows what it is or what the cause is, but that ejaculate is still there. So when the pipes get overfull, then you're going to kind of start seeping this stuff out. And sometimes people can see like a white residue inside. That's one of the causes. Some of the other things could be infection, but that usually is associated with other symptoms, whether it's overactive bladder or burning when you pee. There is a certain set of symptoms that come when it's an infectious process versus something that just may be natural. Now, there's some zebras out there that some rare infections that you can have that can cause the same thing, but that's extremely rare. And
so that kind of made me think of another question I had, that for men, it's one pipe. So it's all coming out of it. Are there differences for men and women in what the color of your pee might be and what it might be telling you?
When I see men and women, it's pretty much the same concerns when they have a discoloration issue with the urine. The additional thing that men have is that prostate, that as it gets enlarged, it can cause blood in the urine or issues with the urine outflow. In women, they sometimes have another problem, especially postmenopausal women. Postmenopausal women can get a lot of dryness in the vaginal area when they lose that surge of estrogen that keeps it hydrated. So in that case, because that lining gets dry, they can have burning when they pee. They can have blood in the urine because of the dryness and the crackling that can happen in that space. And sometimes you mentioned the white residue. If they're getting this lining just staying in there, if they're not emptying their bladder, they can sometimes get a white residue as well. Or if they're taking a whole bunch of antibiotics, end up getting a yeast infection, then that can cause some of the white discoloration as well. So I think in this case, men and women are pretty much the same in what they can have. It's just what's getting in the way and causing them to have an increased risk of it. That's the difference.
So it sounds like kind of the bottom line, if I'm hearing you right, is that red is the color that you really need to take action when you're seeing that. Other than that, you might have reasons to ask your doctor a question, but there's not great cause for alarm.
There isn't. And red again, is that red warning sign. Now, a lot of patients get scared because, what is he going to do to me when I tell him it's red? Like, are they going to do all these crazy procedures? My friend came and told me that they put a big camera inside their penis or their urethra and it hurt a lot. Well, the reality is that is one of the things, but it's really not that bad. And I can say that because I've had that procedure done on myself when I had kidney stone surgery. The procedure, it sucks for about 12, 15 seconds, but that 15 seconds could save your life in so many ways. So in addition to that camera test where we look inside, there's also us having to do some imaging where we look at your kidney. So that could be in the form of a CAT scan. So it's usually when you have blood in the urine, it's usually two major things. Some imaging tests to look at your kidneys, which is usually a specialized CAT scan, and then us putting a camera inside the urethra. The whole process can just take several minutes from the amount of time it takes to get the CAT scan to the scope. And if everything is clear, then great, you're fine. But if it's not clear and we find something like a big kidney stone, or we find a tumor in the bladder, or we find an enlarged prostate that's causing issues straining your bladder, then we really are setting you up in the future, not just from a quality of life standpoint, from a longevity standpoint as well.
Well, this is awesome. I've definitely learned some things today. I don't have anything else. Do you have anything else you would want listeners to know?
I think listeners should, as I mentioned, as you started, is not be embarrassed about bringing up some of these conversations. When you come and see your primary care doctor or a urologist, we don't just focus on the embarrassing topic that you're coming in with. Every single day, I see patients with these issues, but I may discover something else inside of them as I do the full workup. Like we may discover a lab test is high and, oh my God, maybe we should focus on prostate cancer screening. We may discover that the man comes in for one thing, but then we check hormones for another purpose and realize this man has low testosterone. So we're not just going to focus on the problem. We're going to take a very proactive approach to your entire urologic health. And yes, that red urine will be the way that we get you in, but we hope that we can greenlight the rest of your health by doing the full workup.
Well, excellent. Thank you for joining us today, Dr. Brombot. And again, my guest today has been Dr. Jamin Brombot, a urologist and sexual health expert with Orlando Health. And you can learn more about Dr. Brombot at orlandohealth.com.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.